We'd like to welcome everyone to our first edition of the Association Spotlight Series. Today we have our president, Jimmie Beirne of Autism Services Center, and we're happy to sit down with him today. How you doing, Jimmie?
Doing well, thank you.
Great. If you could just go ahead and tell us a little bit about yourself and what you do here for the association and with your position at Autism Services Center.
All right. Well, just like you said, I'm the president of the association, and of course that's a year assignment. And so I've been president since July of this year. I'm the CEO of Autism Services Center, and I've been doing that for the last 5 years. And of course, I've worked at Autism Services Center now for 32 years.
Wow. Yep. And that's great. So tell us a little bit about how you got started out at ASC and what your first job there was.
How did I get started? I started working with an individual with autism, and he was considered a savant. And you can think of savant skills as these extraordinary abilities or talents that can co-occur with a developmental disability such as autism spectrum disorder. He lived at home, and I would pick him up during the week and take him out in the community. And one of the games we used to play was I would ask him to remember license plates as we were out in the community. I thought it was so neat. I would write them down and ask him to remember them. And after 3 or 4 hours out in the community, I would be taking him back home, and I would ask him, "Hey, what were the license plates I asked you to remember?" And I thought it was the coolest thing because he could tell me not only every license plate, but in order, and I don't ever remember him missing a letter or digit.
Wow.
And so when I talk about savant skills, he could multiply 4-digit numbers in his head. He could tell you the square root of any number in his head. You could ask him, you could tell him what your birthday is. He could tell you, the day you were born. But with these extraordinary abilities that I'm describing, he still needed my assistance out into the community. He needed assistance mostly in social interaction and self-regulation. He had a difficult time, in communication, reading nonverbal cues as we communicate, which are so important, or taking the perspective, of someone else and seeing an issue from someone else's viewpoint. And so, it was my job to assist him in interaction and, modeling appropriate behavior in the community.
Right. So the way I understand it, since then, ASC has really just kept evolving since those times in terms of the services you all provide in the community in the tri-state area. And if you just want to talk about
we sure have. Well, we started out in 1979. A remarkable lady named Dr. Ruth Sullivan was the founder of Autism Services Center. We became incorporated in 1979. Her office was her dining room in her house, and her desk was the dining room table. She ran a advocacy and referral hotline. And we started out with 1 employee, and now we have over 400 employees.
Wow.
And we work in West Virginia, Ohio, and Kentucky. And we have an array of services. Autism Services Center is a licensed comprehensive behavioral health center, and we offer 24-hour residential care where we serve over 40 individuals. We offer in-home support where staff are going into family homes providing services. We provide physical therapy, occupational therapy, speech therapy, and our service that's really grown a lot over the last 10 years is applied behavior analysis treatment for children with autism. And we have 3 clinics now in Lincoln County, West Virginia, Huntington, West Virginia, and South Point, Ohio. And we have an array of other services, case management, supported employment, respite services, just to name a few more.
Wow, yeah, that's impressive. What is something that makes you proud about your daily job and what ASC really brings to the area? What does anything stick out to you that you just it makes you happy and puts a smile on your face?
I think just building on what I just said, just the expansion that we've had over the number of years, going into various communities, often very underserved communities where there are no services, and ASC really filling a void in those areas. So, by saying that, we're serving so many more families now than ever before. It's really hard to keep up with the need that we have. We have a waiting list, and we could provide so many more services if we could find staff. That's the main barrier right now to providing more services. And I think when I think of how proud I am of the work that we do, I think the culture that we've created at Autism Services Center, and again, that starts with Ruth Sullivan. Really, she approached running Autism Services Center as a parent. She was a CEO, of course, but she was also a parent of a child with autism. And she really worked very hard with us on ensuring that our services were dignified and they were respectful to the individuals that we serve. She worked very hard at ensuring when we offer services that we administer services with this parent mindset. If this was my child, this was my relative, how would I want services to be delivered? What do they look like? What decisions would I want made if this is my family member? And when you put it in that perspective,
Yep.
It really increases the significance of what you're doing. So we've done our very best at carrying over that hard work that Ruth Sullivan did. Even today, we spend a significant amount of time with our staff talking philosophy and what services should look like as we can define them as dignified and respectful.
Sure. Yeah, just tying into the kind of the workforce shortage issues that our entire state and of course the entire country and the world for that matter, I know that are facing. What are some of those obstacles that are, how are you all trying your best to get around them in this field, as I know it's tough? Maybe just talk about enlightening some folks about the fulfilling parts of these jobs within ASC. Not only, they can be demanding jobs, but also the fulfillment that these positions can bring.
It's so important that, our staff, in fact, a lot of our upper level management staff have a lot of direct care staff experience. And I think that brings so much to their jobs, and because direct support staff work can be hard. It can be very difficult, and there's a lot of rewarding aspects of direct support staff, especially when you see people develop new skills that give them more opportunities in life or increases their quality of life.
Sure.
And being able to go to parents and describe the new skill sets, that their child has developed, and the expression and the look that we get, when we're able to tell parents that.
It's invaluable. Yeah.
Oh, yeah. It is so rewarding, and, getting back to what I was saying before, just you really rely upon those times when things get tough. The grind gets harder, and you're tied up in a lot of issues that you remember. Why are you doing the services? And it's about supporting people and assisting people grow and learn and having higher qualities of life.
Sure. So just real quick, since you started where you were, are there any things that you kind of pull or take from, or how do you think you've benefited in your position now as CEO, as starting as direct care staff, direct support? Just some things that, maybe as opposed to maybe a CEO who's comes in outsider, not as familiar with autism services.
Yeah, in my case, I started out as direct support staff. Then I think I went to assistant manager, then residential coordinator, program director, chief operations officer, CEO.